hello, I'm Sammy McFarlane from Long COVID Kids.
Hi, I'm Sarah from Fort Walton Beach, Florida. So Delaney got sick on June 2nd, a day after her 15th birthday. It was just a sore throat, a fever, a little bit of a dry cough. There were like less than 200 cases in our whole entire county. And they had just started doing the drive-through clinics. And so I was like, you know what? We had just had a party for her. Our area had just come out of lockdown 2 weeks prior. She had, we wore masks, but she had gone back to dance. And they weren't wearing masks in dance. And so I was like, let me just take her through the drive-in clinic just to make sure. And 2 days later, we tested her on June 4th. On June 6th, we got the call that she was COVID positive. And by the time we got the call that she was positive, her fever was gone. We thought she was actually getting better. She did. I tell people she had a mild case, but mild at that time, all we saw in the news were people dying in hospitals and they're having to set up makeshift hospitals. Italy was like just devastating. And so you really didn't hear of a lot of mild cases. They're saying kids didn't get it, period. And then like in our area, she was number 255. And like last week, I think we had 256 cases in one day. So like, we're like almost at 9,000. So she was like really early on in our area.
Yeah.
So we had to quarantine with her. And then my husband and I had to quarantine an additional 2 weeks. And so she was a competitive dancer. She danced probably 5 to 7 hours a day. Some weekends we go to dance conventions where she danced all day in classes and then compete in the evenings. And so she started to go back to Zoom classes, and she couldn't make it through just the warm up. She would come out crying, I can't breathe, I feel like I'm going to pass out. And so when my husband and I came off of quarantine, my husband's retired military, so I called the base hospital to get an appointment, and they're like, we won't see her. She has symptoms of COVID. I said, well, but she's past it. She's off quarantine. They're like, we won't see her. She's like, we have an outside clinic called the respiratory clinic where they see you intense. We can, get her seen there. And so they got us an appointment. They call you about an hour before just to go over your symptoms. And I explained that she was a dancer and how she just couldn't dance anymore. Like she was like super athlete to getting winded doing like a bar exercise. And so they're like, we're going to send you just to the ER to get an x-ray. And so the x-ray came back negative. You couldn't see anything. It was clear. And they just sent us on the way. They're like, this is like mono, just go home, treat it, and from day one, like we were never told like how to treat it. We weren't given a prescription for steroids or anything like that. So when she was in the ER, her resting heart rate was like 100, or maybe it was 99, which was high for her. And so when the doctor called the next day, I'm like, I'm hearing stories with people having cardiac issues. I really want her to be looked at. And she said, as long as she's fatigued and short of breath, she cannot come into the peds clinic. And I said, so how long are we going to do this song and dance? How long are you not going to see my child? At what point do we say this is enough? She's, well, I really don't know. We don't know anything about COVID, and we don't know anything, especially with kids. She's just a pediatrician. And she's like, I might give her some steroids because I've heard steroids might help with COVID. But I have to do a little bit more research on that. Well, a week passed and we had the follow up, and the new pediatrician, because they have like a bunch on base. And she said, Mrs. DePew, I went ahead and I'm referring her to a pediatric cardiologist just to be on the safe side, And so we went to Nemours in Pensacola, which is about an hour away from our house. And the cardiologist did an EKG and an echo. And she's like, we explained that she was a dancer. And she's like, everything looks good, but something's not right. She's like, I'm going to speak to our pulmonologist and do a PFT, which is pulmonary function test. And at that time, she got like a 78 or 79, which is below average, but just barely below average. And so they made an appointment, we had to get another referral from base to go see, the pulmonologist. And he's like, well, she has, they did the test and it went lower. And he's like, she has restrictive airway disease. He's like, I don't know how long she will have it. I don't know if it's permanent. I don't know if it's,
And did he say that in front of your child?
Yes. He's like, we just don't know. And so this was probably end of July. And so they sent us for like a cardiac stress test. And when they did that, that's when we kind of really knew something was wrong, because they do like an initial PFT and then they do it right after they do the stress test, and it dropped by 30 points. And so they had to call in the cardiologist. She couldn't finish the test. She was just so out of breath. I think she only lasted like 6 minutes, and she didn't even get into like a jog. And they had 2 respiratory therapists, and they're like, it's dropped by 30 points. And they're like, does she have asthma? I'm like, no. Does she, they just didn't understand. And they had to do like an emergency albuterol treatment and send us for steroids and everything. And so basically for the next couple of appointments, she got worse and worse and worse. And they would give her steroids, and then they give her a higher dose. They give her steroid inhaler. But like the pulmonologist, I think at the last one at Nemours, her lung function was like down to like 49%. And he's like, I don't know what to do. He says, come back and see me in 2 months. And the next step is to put her on oxygen at night. And he's like, but I'd like for you to see an infectious disease doctor. And so we got the referral.
How is she, if her lung function, he's saying about 49%, when she's sitting still, how is she then?
She's fine.
Yeah.
So like she gets, no, like the PFTs are when they just test. So basically she had, like, you hear a lot of people with tachycardia, and so her heart is fine. Her heart is having to compensate for her lungs. And so if you just were to look at her, you'd be like, oh, she looks fine. She could walk around the house okay. But like if we go to the store, within like 10 minutes, she's looking for a chair to sit down in. This is someone who,
things that we have with long COVID is that, from the outside, often people do look well and the symptoms are in clusters, they come and go, and it's very difficult for people to understand.
Yes. Yeah. And so, and I've, been more at the adult groups. You hear so many people having the tachycardia, and the cardiologist says everything's fine, but they're not seeing the pulmonologist and getting the lung function test. And, your heart and your lungs kind of work together. And so her heart's healthy, but your heart's a muscle. So over time, I mean, she's checked in, her resting heart rate has been 145. And that's just walking from the office to get her blood pressure. And, they're like, wow, what,
So no one's really coordinating her care or her recovery.
Well, so we got sent to Sacred Heart and to the infectious disease doctor, who basically, she deals with kids who were sick with COVID, which Delaney was past the sickness. And she's like, I want you to get a second opinion with our pulmonologist. So their pulmonologist did an even more extensive PFTs, and she said that Delaney has is obstructive, so it's chronic obstruction pulmonary disease, severe. So like and she said, I think it was basically like this popcorn lung. She's like, but it hasn't been like, Delaney will be the first person to have it with COVID. And so they sent her for all the testing, and her lungs were once again clear. And so now we're being sent to University of Alabama at the end of December, because they're thinking more that COVID might be more of the cellular level. So that's why like CAT scans and things are not showing up. So her function tests show that she has these issues, and if she does any kind of like, her dance teacher does privates with her, or was doing privates, and it's just basically like a stretch class, and her heart rate shoots up like sky high.
I can really empathize with that, because I've also been diagnosed with COPD, and my lung function at the moment, they're saying, is about 50%. So I can completely empathize with what you're saying. And I'm okay kind of shuffling around in the house. But if I try and do something where there's any exertion, like a simple slope to walk up, or, just walking up the stairs if you forget something, then it's really difficult. And actually talking whilst moving is very difficult, whereas previously I was very fit.
Yeah, and looking at you, you would think that you look just fine, and so, yeah, I think that it's, and they just don't know how COVID is causing the COPD, I guess.
Yeah, and we're in the same situation here where getting testing is very difficult. I think possibly even harder here, and certainly so far tests aren't showing any reason behind the symptoms, which has got everybody scratching their heads. So we just desperately need that research to kind of move things forwards. And have they given you any advice about whether she should or she should not be exercising?
So the first pulmonologist said that she can't dance because if she dances, she'll pass out, but she can stretch, and so it's not, they haven't really said. The second pulmonologist, was more, we have to keep her away from even she basically said to me and my husband, if she gets a cold, it could put her in ICU, even though she looks fine.
Yeah.
But I feel like here, especially where we live, people are just, they see a mask as like the government trying to control them.
Yeah.
So
I've seen a lot of that. I've seen a lot of that on social media. And I find it really hard to relate to. I think if you're living in the bubble, having been infected with COVID and then having these long-term symptoms, it's very hard to relate to that mindset. And yeah, I'm not really sure how we go about changing that other than keep talking about our situation.
And I have found, I have heard through the grapevine that other kids have gotten it, and parents are so they don't want to talk about their kids having COVID because it's like you almost get that scarlet letter, and Delaney early on, even though she was past, people were weird about coming around her, but then they would go off and do things without masks on. So you're like, you know what I mean? Probably my daughter's safer than a lot of most people you come. And she was able, with the doctor's approval, to have a sleepover because it's been very isolating for her. And she had two friends that they wear a mask all the time, and they had to wear a mask with, at the sleepover the entire time, and then they slept in different bedrooms. So
that makes really good sense. And how is her mental health from this whole sort of situation?
I think kids are a lot more resilient than adults are. I feel like I think it's probably harder for me just to see, because she just sees oh, I'll be able to dance one day. I'll be, there's, that kind of, you have no sense of, I know before you have kids, you're kind of like, oh, nothing could ever happen to me. I'm immortal. And then you have kids and you worry and
Yeah.
So, I think there's some times where she's like, oh, I really want to hang out with a friend, and so we were doing like I said, the dance privates, but the numbers started to really pick up here. And so it's, for her, it's not even about COVID, it's about the flu, it's about a cold. So we really have to, watch her. And then, you're asking about the physical activity. She did a second, stress test, and for a week after, she was just not well. So I can see if she does too much, it kind of knocks her out.
So does she have kind of peaks and troughs the whole time? Is she having relapses, or is it kind of consistent most of the time?
It's consistent with if she does too much. We had already homeschooled because she danced so much. She was in a pre-professional dance program for the last 2 years where they went, and so they went during school hours. And so, which was good because we already are used to the online schooling. And now, she has more time to do the schooling because she's not dancing. So, I don't know. I think she misses the dance. I think the dancing is what really kind of she misses, and having that activity level, but she was, already, I feel like social media with like TikTok and Instagram, it still allows them to connect. I think kids are a lot more, like I said, resilient than adults are.
Yeah, I definitely think you're right. And, thank goodness we have that technology for them to be able to connect, because they really need it this year, particularly.
Yeah. Delaney did get into a fight with one of her friends with other things, but it was, she's like, she's not wearing a mask. And I'm like, you can't judge. I mean, it's really hard not to judge people, when you're on one side and they're on the other.
Yeah. And she's fearful of getting reinfected.
I don't necessarily know that she's fearful, but she just knows that COVID is real, and that she cannot stand to see people not wearing a mask. Like in some counties, like 2 counties over, they require masks, but in our county, it's optional. So most kids, I think more in the beginning, kids were wearing masks, and now they don't. But they try to separate the desks 6 feet apart. Or I don't even know if they really can, and they put shields up. But so if someone gets,
excuse me,
bless you.
Thank you.
So if someone gets COVID in the classroom, if you were in 6 feet of them, then they'll isolate those children.
Yeah.
But yeah, masks are not required. Our state is completely open.
So masks aren't required, but the numbers are still going up.
Yes.
Yeah, and people still don't want to wear the mask.
No, I think they're getting with the holidays, and it's hard in America because we had the election, and people are like, oh, it's because the election and COVID, after the election it will go down, and no, it's not going down. And and it's almost like you have some states that are like no rules whatsoever, and then some states that are telling you how many people you could have at Thanksgiving, and I can understand like not being, if you have like a bigger family that they've all wear masks in their quarantine, like you should be able to have however many you want at Thanksgiving or Christmas dinner per se. But it's so that you get these states that are so liberal or so conservative with their thinking that but then you have some states that are kind of more moderate, that they did do a mask mandate and they locked down early. So and some of it's just, some places are just more populated, and you find that some places have a mask mandate, but then like they're doing things with friends, on the side and not wearing a mask. So I don't know.
And how about you and your family? Do you wear a mask when you go out?
Yes.
All the time.
Yeah, we have 30 of them hanging by the front door. So
Us
yeah,
too.
and I was just telling Delaney, it's getting to the point to where we'll probably start having groceries delivered. My husband works for Coca-Cola, so he has an essential job per se, but it's just you're seeing less and less people wearing masks in the store. Even though the stores require masks, people don't wear them. And then we get a lot of tourists that come into our area that don't wear masks, so it's kind of,
it's a challenge.
And
how's she feeling today?
Well, she's still asleep.
Oh, okay.
She's still asleep right now. We I used to be one of these moms that you need to be up by like 7:30, and now I just let her body tell her what she needs. And
okay, well, thank you for talking to me today.
Yes, thank you. It's very nice to meet you, and thank you for doing this, because I had tried looking like 2 months ago for a long hauler group for kids, and there wasn't any. And I'm like, I know that there are kids out there like what Delaney's going through. So
there are so many children. Thank you so much.
Thank you. Happy holidays. Merry Christmas.
And you take care.